Good morning, Lambton County Council, members of staff, and public that's joining us today. Welcome to this wet April. I'd ask Ms. Leger to take the roll call, please.
Thanks, Warden. Deputy Warden Agar. Councillor Atkinson. Present. Councillor Bushi. Councillor Bradley.
At the meeting.
Councillor Broad.
Present.
Councillor Case. Present. Councillor Cook. Present. Councillor Dennis. Present. Councillor Ferguson. Present. Councillor Grimes for Councillor Hand. Present. Councillor Loosely.
Present.
Councillor McRoberts. Councillor Miller.
Present.
Councillor Sageman.
Present.
Councillor Veen.
Present.
Councillor White.
Present.
Warden Marriott.
Present.
We have quorum.
Thank you. We acknowledge that this land on which we are gathered today is part of the ancestral land of the Chippewa, Odawa, and Potawatomi peoples referred to collectively as the Anishinabeg. It is through the connection of the Anishinabeg with the spirit of the land, water, and air that we recognize their unique cultures, traditions, and values. Together as treaty people, we have a shared responsibility to act with respect for the environment that sustains all life, protecting the future for those generations to come. I would ask any member of council to declare a pecuniary interest now or where it may arise during the meeting. Seeing none, I'd look for a motion to go in camera for the reasons noted in the agenda. Councillor Bushi and Councillor Loosely seconds. All in favor? That's carried. We'll be in committee room 3. Welcome back. Please join me for a moment of silent reflection. Thank you. I'd ask Ms. Leger to rise and report from in camera, please.
Thank you, Warden Marriott. I can report that Lambton County Council met in camera this morning for a few minutes to address a few matters. First being to review and approve the Lambton County Council closed session minutes of February 5th, 2025. Secondly, Council reviewed and approved the Committee of the Whole closed session minutes from February 19th, 2025. That include receiving a report and providing instructions regarding negotiations between the county and a third party related to service expansion, receiving advice subject to solicitor-client privilege regarding correspondence received by the county, and then thirdly, to receive information regarding commercial information explicitly supplied in confidence by a third party regarding a development plan.
Thank you, Ms. Leger. Item number 8, minutes of open session council of February the 5th and March the 5th. I'd look for a motion to receive and file these. Councillor Sageman and Councillor Dennis seconds, all in favor. That's carried. Item number 9, Board of Health. Dr. Duick, please. Item 9A, we have 3 correspondence to receive and file if there's no questions. Councillor Bean moves and Councillor Dennis seconds. All in favor? Let's be carried. Thank you. And Board of Health information reports. There's 3 of those to receive and file unless there's questions. Councillor Miller moves. Councillor Atkinson seconds. All in favor? That'd be carried. And 9C, Board of Health other business. Dr. Duick will provide an update on avian influenza and measles. Please, Dr. Duick.
Thank you, Warden. I'll begin my presentation now. Dear County Council, Board of Health, today I am providing you a situation update on measles and avian influenza as pertains to Lambton County. First, I will review the situation around measles. Measles is a highly contagious but vaccine-preventable disease, eliminated in Canada in 1998, given a long history of highly effective measles vaccine. Measles is spread through the air when an infected person breathes, coughs, or sneezes. Symptoms of measles include fever, red blotchy rash, red watery eyes, cough, and runny nose. The best protection against measles is a full measles vaccine series for anyone born in or after 1970, with a first dose at 12 to 15 months of age and a second dose at 4 to 6 years of age, according to Ontario's routine vaccination schedule. Of note, adults born between 1970 and 1976 were only eligible for 1 dose of measles-containing vaccine and were not offered a second dose during the measles second dose campaign in schools in 1995 to 1996 across Canada. Thus, for measles exposure contact management, those adults with only 1 dose would be offered a second dose of measles-containing vaccine. Those born before 1970 are considered immune to measles. Until 2024, measles cases were most often associated with travel. Due to an increase in measles activity globally in 2024, Ontario began to see more travel-related cases of measles about a year ago. This current multi-jurisdictional measles outbreak began October 18th, 2024, starting in New Brunswick and now impacting Ontario and Manitoba. According to Public Health Ontario, recent sharp increases in the number of outbreak cases and the geographic spread is due to continued exposures and transmission among individuals, primarily in close communities who have not been immunized against measles. The multi-jurisdictional measles outbreak beginning in New Brunswick reached parts of southern Ontario mid-October 2024, disproportionately occurring among close, unimmunized or under-immunized communities. Since then, 13 public health unit regions have been impacted with outbreak-related measles. Of these, the Ministry of Health has listed measles areas of concern as Southwestern Public Health with approximately 44% of cases, Grand Erie Public Health with approximately 20% of cases, and Huron-Perth Public Health with approximately 10% of cases. Anyone living, working, or traveling in these areas is at higher risk of measles exposure, and children are eligible to receive measles-containing vaccine earlier than the routine schedule, with a first dose as early as 6 months of age, with full details sent to local healthcare providers from Lambton Public Health. Of 453 confirmed measles cases related to this outbreak, as of March 26th, 2 lab-confirmed cases of measles occurred in Lambton County. Of the outbreak cases, 93.8% of infant to adolescent cases were unimmunized. An additional 22 cases of measles not linked with the outbreak in Ontario are reported during the same period, with 5 due to travel outside of Canada, 1 linked to a visitor to Ontario, and 16 with no known source of exposure. Lambton Public Health fulfills its role for measles prevention and response, largely by requiring proof of immunization for students attending schools in Ontario, in accordance with the Ontario Public Health Standards Protocol and the Immunization of School Pupils Act. As a result of diligent efforts by Lambton Public Health, in coordination with schools and healthcare providers, Lambton's measles vaccination rates are 90% of 7-year-olds and 96.5% of 17-year-olds. Herd immunity is achieved when 95% of the population is immunized against measles. According to the Canadian Immunization Guide, 1 dose of measles-containing vaccine offers 85 to 95% protection, and a second dose approaches 100% protection. Year-round, Lambton Public Health offers a preventive approach, providing measles immunizations for patients unattached to a primary care provider and receiving orders and delivering measles vaccines for community healthcare providers. In the event of a measles case, Lambton Public Health conducts case and contact investigation with isolation instructions. The Infectious Disease Prevention and Control Team has developed resources to ensure seamless information sharing related to case consultations within our community. For any settings exposed to a case of measles, Lambton Public Health will contact the facility and coordinate sending direct measles exposure letters to their contacts. Media releases are also issued to ensure anyone who did not receive a letter is aware of their exposure. A new online measles screening tool has been developed to help members of our community screen themselves if they've been exposed to a measles case and provides guidance on next steps. The Immunization and School Health team has been responding to calls from the public regarding their measles immunizations. Measles post-exposure prophylaxis would be indicated within certain timeframes with either an MMR vaccine or immune globulin if someone susceptible to measles was exposed to a measles case, with a goal to lower risk of infection or to reduce severity of illness, which Lambton Public Health assists to coordinate. Lambton Public Health has been engaged with healthcare settings such as the hospital and regular correspondence through newsletters and updates since last year in 2024, available on the Healthcare Professionals online portal. Key messages to the community advises if any individual has symptoms of measles, they are to immediately self-isolate at home and call their healthcare provider so they can take infection prevention and control precautions or call Lambton Public Health for advice. The Ministry of Health provided a presentation on March 21st, inviting all hospitals, primary care providers, and public health units, with slide 17 from their presentation outlining roles and responsibilities of community public health units, hospitals, and family physicians and nurse practitioners who provide primary care. These roles and responsibilities have been communicated with local healthcare providers for common understanding of our work together for prevention, mitigation, and response to measles in this area. Additionally, Lambton has received confirmation of cases of avian influenza in local poultry operations, with 2 reported in March 2025 and one reported in December 2022. The H5N1 avian influenza A virus was first detected in birds in Ontario in March 2022, with the same strain of the virus having been detected in many other jurisdictions around the world. The spread of avian influenza in birds has primarily been attributed to the migration of infected waterfowl. In Canada, avian influenza mostly affects domestic poultry, geese, ducks, and shorebirds. For human health, the Public Health Agency of Canada, or PHAC, their most recent risk assessment deems the risk for the general public to be low. However, the risk is higher for those who work with sick animals or in contaminated environments, such as farmers. Individuals should take precautions, such as personal protective equipment, when interacting with and handling birds. Human infection with avian influenza is rare and usually occurs after close contact with infected birds or other infected animals or highly contaminated environments. There have been no human cases in Ontario or Lambton County to date. PHAC and the Canadian Food Inspection Agency are the lead agencies for avian influenza prevention and response in Canada. In a snapshot on the slide from a Ministry of Health presentation, animal partners are on the left. For human health, in the column on the right, partners include Public Health Ontario and Ontario Health that work with PHAC, along with Indigenous Services Canada and the National Microbiology Laboratory, with local public health units responsible for human health contact follow-up, described on the next slide. Since April 2024, following a Chief Medical Officer of Health memo regarding avian influenza in livestock in the US, Lambton Public Health has maintained an avian influenza preparedness checklist and up-to-date information. PHAC notes that although there has been avian influenza detected in dairy cattle in the US, no cases of avian influenza have been reported in livestock in Canada. Lambton Public Health has provided key messages regarding the prevention of avian influenza detected in dairy, Lambton Public Health has provided key messages regarding the prevention of avian influenza to the public and at-risk populations, which includes farmers or individuals who handle sick animals or birds. Lambton Public Health's environmental health team is involved in responding to notices received from the Ministry of Health when it comes to activity linked to avian influenza. Timely response is required to ensure those who are at risk, who work at the premises, receive self-monitoring and follow-up instructions according to Ministry of Health and Public Health Ontario guidance. This involves coordination with the Infection Prevention and Control team and external partners. Lambton Public Health works with the County Emergency Management Coordinator to keep them abreast of any avian influenza detected locally in poultry for their awareness and support should it be needed. Lambton Public Health continues to prevent and respond to measles and avian influenza, and thanks County Council, our Board of Health, for their support, along with all partners we work with in the County of Lambton. Thanks very much.
Thank you, Dr. Duick. Are there any questions? Oh, Deputy Warden Agar, please.
Just an off topic. Have you got the results back yet from the testing in the river from the latest spill? And how far did you go down? Not you personally, but how far did it go down the river? Thank you.
Dr. Duick, please.
Through you, Warden, thank you. I am still waiting for the results from the Ministry of Environment, Conservation and Parks and their interpretation. The sampling results are taken upstream at the source and downstream of the spill. And through the report from the MECP to myself, they had noted that the spill had not been contained to the industry dock and may have reached the Corunna area, which is why the do not use was issued.
Any other questions for Dr. Duick today? Seeing none, thank you, Dr. Duick, for your presentation this morning. We have no correspondence under item number 10. That brings us to number 11, information reports. We have a report on the Sanctuary Security Inquiry. Social Services. There's no questions. I look for a motion to receive and file. Councillor Bean and Councillor Ferguson. Oh, sorry, Councillor Bradley, please.
Thank you, Mr. Ward. A related question. What is the timeline now on the closure of the overflow shelter on Melrose?
Ms. Colasani, please.
Through you, Warden, to Councillor Bradley. At this time, we don't have a specific timeline. We're still waiting for information on the Heart Hub and when we might be able to start to do some work on that building and move. We're still seeing high occupancy in the shelter, in the overflow shelter, although it has dropped somewhat. So at this time, as I said, the earliest we could be looking at is most likely the end of the year.
Okay, then a follow-up question. There's a report on Blackburn Radio today about the Heart Hub. And after reading, I'm totally confused. It talks about the center of it and the project being with Canadian Mental Health and their location. Yet my understanding was there was another location being looked at, and at the city level, we're still waiting for a rezoning application to come in on that other location. But the article today did not indicate there was another location. Is that now on the back burner and they're going to do it all at Canadian Mental Health?
Ms. Colasani, please.
Through you, Warden, to Councillor Bradley. The Heart Hub itself will host the Housing and Homeless Resource Center. It'll host the addiction withdrawal management programs. I think what you might be referring to is the piece of the application that was a 30-bed withdrawal management through Blue Water Health. That was never intended to be located at Lochiel. That'll be at another location, and I think that's the location that you're referring to. There are also another location within social housing where we'll be doing some supportive housing with Indwell. So it's not all being located at the one place on Lochiel.
Okay, well, thank you. That's not the impression that was given this morning in that report. So, we worked hard to get this Heart Hub, and it seems just like the expansion of the hospital with 24 beds. We're waiting and waiting and waiting. And again, this other location, I've been expecting for months. I actually even offered to call a special meeting to deal with the rezoning application. So every day is a day wasted. So I'm sort of puzzled by the lack of urgency. Other communities are getting up and running right now.
Wish to comment, Ms. Colasani?
Certainly, through you to Mayor Bradley. CMHA is the lead on the Heart Hub in Lambton County, and we've not received a budget yet or any confirmation. My understanding is the locations that were safe consumption sites, there were 9 of them. The ministry, after the writ dropped and then they started to work again, the focus is on those sites. So we've received information that the focus is on those sites. They had to be up and running or closed with the new sites up in April. We've been pushed back a little bit. So we are moving forward. We are looking to hire a coordinator. We've had weekly meetings, but in the absence of any type of contract or a budget confirmation, it is a little challenging to move quickly.
Okay, well, thank you for that update.
Okay, I have a motion on the floor. If there's no other questions, motion on the floor to receive and file. All in favor? Those opposed? That's carried. Item number 12, items not requiring a motion, the Sarnia-Lambton Economic Partnership minutes dated January 28th. Look for a motion to receive and file those. Councillor White and Councillor Grimes. All in favor? That's carried. Item number 13, reports requiring a motion from the Office of the CAO, report regarding the USA tariff purchasing response. Councillor Case, you move, and Councillor Cook seconds. All in favor? Those opposed? That's carried. And that brings us to the committee minutes of February 19th. Under Infrastructure and Development Services, number 1 was a correspondence received and filed. Under Information Reports for Infrastructure was motion number 2 to information reports that were received and filed. And number 3 was a report regarding the update on appointment bylaw for building inspectors. Number 4 was report regarding update on delegation of approval authority under the Planning Act. And number 5 was a report on the County Road 19 reconstruction. Under Cultural Services Division, number 6 was information reports. Reports requiring a motion on the library's donations up to December 31st was motion number 7. And number 8 was a report regarding library services, Township of Don Euphemia. Number 9 was a report regarding the museums, galleries, and archives collection management as of December 2024. Under Long-Term Care Division, motion number 10 was long-term care information report. And under Corporate Services Division, motion number 11 was correspondence that was tabled. And number 12 was information report regarding court services. And under Finance, Facilities, and Acquisitions was motion number 13, a report on the year-end report on reserves and reserve funds. And under Social Services, I had motion number 14 on information reports for Finance, Facilities. In camera, number 15. And number 16 and 17 were in camera as well, and 18 was adjournment. 19 was adjourned. Look for a motion to receive and file those. Councillor Dennis and Councillor Cook, all in favor. That'd be carried. And we also have the Woodlands hearing board minutes of March 25th. Look for a motion to receive and file those. Councillor Sageman and Councillor Miller, all in favor. That's carried. There are no items tabled from previous meetings. Look for other business. Councillor Case, please.
Yes, Mr. Warden, through you to Jason Cole, if I could. Jason, we were taking a drive the other day on the stretch of road, Nauvoo Road between Watford and Alvinston, that piece that was reconstructed last year. And the level of repair of that road is not real good after just having construction literally wrap up 3 months ago. I'm just wondering if you're aware of that. It seems to be in fairly poor shape for a newly constructed road. Just wanted to make sure that you were aware of it, and if you were aware of it, maybe if there was any action that was going to be taken to repair it, because it is in very poor condition for a road that was just done in a short time ago. So if it could get a response, we'd appreciate it, Mr. Warden.
Mr. Cole, please.
Thank you. Through you, Warden, to Councillor Case. That road would still fall under our warranty period, and we will be working with the contractor to manage that through their contractual obligations. We will have to look at and see exactly what defects and the causes of those defects are, but we will want to resolve that with the contractor within the contract period.
Follow-up, Councillor Case.
So I can, Mr. Warden. I guess my follow-up would be, I'm obviously glad there's a warranty in place for that, but I guess my question is, were you aware of that, Mr. Cole, the condition of that road?
Mr. Cole, please.
I was aware that our staff were looking at and working with the contractor to have those discussions, and that those would be ongoing.
Okay, maybe if I could, Mr. Warden, I'd like to ask for at least a report back on the condition of that road and potentially what's going to happen to fix it. Because like I say, for a road that we just had construction performed literally months ago, it's in very poor shape in my opinion. But again, I'm not an expert, I'll leave it to them. And I look forward to hearing back on what's going to happen with that stretch of road. Thank you.
Okay, thank you. We need a seconder. We have a seconder for that request. Councillor Loosely, seconds, all in favor? That's carried. Is there any other business? Councillor White, please.
Thank you, Warden. Just brought this up the other day at Sarnia Council meeting as well, and, just want to highlight that given the current climate for travel, as we enter the summer season. Attitudes of Canadians have certainly changed as to where they intend to spend their dollars and where they plan to go for their vacations, and obviously the changes leaning more towards domestic travel. So perhaps if we could just check in with TSL to find out if they're shifting their marketing plan at all, it would be advantageous if we could target more Canadian markets and try to draw some of those domestic dollars right into Lambton County. Thank you.
Okay, thank you. Who will we'll look after that? Councillor Dennis.
Thank you. It would also be advantageous for them to try to put a campaign on to encourage Americans to come over here too as well. Their dollar has never been quite this high before. Their buying power is huge. And barring any insults from local politicians to American people that have no responsibility on what their crazy president is doing, we should take advantage of this. They should be coming over here and spending money at our restaurants and our shops because their dollar is going much higher than it ever has before. So that's what we need to be doing. We need to be opening our arms to our American friends, and they are our friends. They're not just our neighbors. So that's what we should be doing. Any smart business person will tell you that. You don't step over pennies to pick up dollars.
Okay, we'll let TSL know that as well. Is there any other business? Councillor Atkinson, please.
Thank you, Warden. This actually isn't a business, but just a thing I'd like to recognize that today is World Autism Awareness Day. And since Lambton County is actually the head office of St. Francis Advocates, which takes care of, I think, 13 locations throughout southwestern Ontario, and the good work that they do for families that have children with autism, I just would like to recognize that as we move forward today.
Thank you, Councillor Atkinson. Any other business? Seeing none, I'd ask Ms. Leger the notice of bylaws, please.
Thanks, Warden. It is moved by Deputy Warden Agar, seconded by Councillor Atkinson, that bylaws 8, 9, 10, and 11 of 2025, as circulated, be taken as read for a first and second time.
All in favor? Opposed, if any? Thank you.
It is moved by Deputy Warden Agar, seconded by Councillor Atkinson, that bylaw 8, 9, 10, and 11 of 2025, as circulated, be taken as read a third and final time.
All in favor? That's carried. Thank you. And I'd look for a motion to adjourn. The next meeting will be Wednesday, May the 7th, with in-camera starting at 9. Look for Councillor Veen moves and Councillor Atkinson seconds. All in favor? That's carried. Thank you. Please join me with O Canada.
O Canada.